Today's topic for the video is the cancer. Cancer can be treated by surgery, chemotherapy, radiation therapy, hormonal therapy, targeted therapy, including immunotherapy such as monoclonal antibody therapy and synthetic electricity, most commonly as a series of separate treatments. Example: chemotherapy before surgery. The choice of therapy depends upon the location and grade of the tumor and the stage of disease as well as the general state of patient helps in uh, determining the best therapy for the cancer. A number of experimental cancer treatments the undercurrent estimates 2 in 5 people will have cancer at same point in their lifetime. Complete removal of the cancer without damage to the rest of the body. That is achieving cure with near zero adverse effect. It's the ideal if rarely achieved goal of treatment and is often the goal in practice. Sometimes this can be accomplished by surgery, but the proportionality of cancer of invade adjacent tissue or to spread or distant sites by microscopic metastasis. Often, limits of effectiveness and chemotherapy and radiotherapy can have a negative effect on normal cells. Therefore, cure with non-eligible adverse effects may be accepted as a practitioner goal in some cases. And because cancer refers to a class disease, it is unlikely that there will ever be single cure for cancer, any more than there will be single treatment for all infectious disease. Types of treatments. The treatment of cancer have undergo evolutionary changes. First is surgery. In theory, non-hematological cancers can be cured if entirely removed by surgery, but this is not always possible when the cancer has metastasized to other sites in the body prior to surgery. Complete surgical excision is usually impossible in the Halsted model of cancer progression. Tumor grow locally, then spread to the lymph nodes, then the rest of the body, and this has given rise to popularity of local-only treatments such as surgery for small cancers. Even small localized tumors are increasingly recognized possessing metastatic potential. Surgery may be performed before or after other forms of treatment. Treatment before surgery is often described as neoadjuvant in breast cancer. The survival rate of patients who receive neoadjuvant chemotherapy are no different from those who are treated following surgery. Giving chemotherapy earlier allows oncologists to evaluate the effectiveness of the therapy and may make removal of the tumor easier. However, the survival advantages of neoadjuvant treatment in lung cancer are less clear. Second is radiation therapy. Radiation therapy, also called as radiotherapy, X-ray therapy or irradiation, is the use of ionizing radiation to kill cancer cells and shrink tumors by damaging their DNA. The molecules inside cells that carry genetic information and pass it from one generation to the next, making it possible for these cells to continue grow and divided. Radiation therapy can either damage DNA directly to create charged particles within the cells that can be turn damage the DNA. Radiation therapy can be administered externally via external beam radiotherapy or initially via brachytherapy. The effects of radiation therapy are localized and confined to the region being treated. Radiation therapy may be used to treat almost every type of solid tumor including cancers to the brain, breast. uh, cervix, larynx, liver, lung, pancreas, prostate, skin, stomach, uterus, or soft tissue. Radiation is also used to treat leukemia and lymphoma. Radiation does to each side depends on a number of factors, including the radiosensitivity of each cancer type. Radiation therapy can lead to dry mouth from exposure of salivary uh, glands to radiation, resulting in decreased saliva secretion. Post-therapy, the salivary glands will resume functioning, but rarely in the same fashion. The third is chemotherapy. Chemotherapy is the treatment of cancer with drugs that can destroy cancer cells. In current uses, the term chemotherapy usually refers to cytotoxic drugs which affect rapidly dividing cells in general. In contrast with targeted therapy, chemotherapy drugs interfere with cell division in various possible ways, example with the duplication of DNA. Chromosomes. Most forms of chemotherapy targeted on rapidly dividing cells are not specific to cancer cells, although some degrees of specificity may come from the inability of many cancer cells to repair DNA damage, while normal cells generally can. Hence, chemotherapy has a potential to harm healthy tissue, especially those tissues that have high replacement rate. Example, intestinal lining. These cells usually repair themselves after chemotherapy. Because some drugs work better together than alone, two or more drugs are often given at the same time. This is called as combination therapy. Most chemotherapy regimens are given in combination. The treatment of some leukemias and leukomas required the use of high-dose chemotherapy. The total body irradiation. This treatment enables the bone marrow and hence the body ability to recover repopulate the blood. Next is targeted therapy. Targeted therapy, which first became available in late 1990s, had a significant impact in the treatment of some types of cancer and is currently a very active research area. This constitutes the use of agents specific for the degraded proteins of cancer cells. Small molecules targeted therapy drugs are generally inhibitors of enzymatic domains on mutated, overexpressed, or otherwise critical proteins within the cancer cells. Prominent examples are the tyrosine kinase inhibitors. Targeted therapy can also involve small peptides as hormoning devices, which can bind to cell surface receptors or affected extracellular matrix surrounding the tumor. Radionuclides, which are attached to these peptides, eventually kill the cancer cells if the nuclides decay in the vicinity of the cell. Photodynamic therapy (PDT) is a ternary treatment for cancer involving photosensitizer tissue oxygen and light, often laser. PDT can be used as treatment for basal cell carcinoma. Next is immunotherapy. Cancer immunotherapy refers to a diverse set of therapeutic strategies strategies designed to include the patient's own immune system to fight the tumor. Contemporary methods to generating an immune response against tumors including intravesical immunotherapy for superficial bladder cancer and use of interfaces and other cytokines to induce an immune response in renal cell carcinoma and melanoma patients. Allogenic hemostatic stem cell transplantation, that is bone marrow transplantation from a generally non-identical donor, can be considered a form of immunotherapy since the donor immune cells will often attack the tumor in a phenomenon known as graft versus tumor effect. For this reason, allogenic electricity leads to the higher cure rate than autogenous transplantation for several cancer types, although the side effects are also more severe. Next is hormonal therapy. The growth of some cancers can be inhibited by providing or blocking retained hormones. Commonly example of hormone-sensitive tumors including certain types of breast and prostate cancer. Next is antigenesis inhibitors. Next is synthetic electricity. Thank you.